Hello, we're going to start case number 172-39891. Patient has a history of autoimmune disease. This is SRT retest. And if we think about what SRT is, just a reminder, it's stress resistance testing. And stress resistance testing is we're looking for resistance. So very similar to a wire in a circuit. So the more resistance in a circuit, the more heat it's going to generate, and the more potential for inflammation is going to occur. Another analogy to SRT is imagine a roadway. So as we're driving along the road, as long as we keep it between the lines, if you will, everything is normal. But if we start to go off into the bumper pad, and it alerts us, and that's analogous to acute stress, and it says, okay, we've got an issue and we need to make a correction or we're going to go down here in the ditch, right? So acute stress has two options: a 50-50 chance it's going to go back on the road, or a 50-50 chance it's going to go down in the ditch. Well, down in the ditch means chronic stress. And chronic stress is equal to dis-ease. The body is out of balance, and that can lead to disease. In this case, it led to autoimmune disease over time. So after a few retests, we see improvement, but we think about the body is related to the genetics, and the environment is related to genetic expression. So when the body's under some level of stress, it can adapt and go back into normal health range, or it may succumb to stress because it's a more prolonged stress. So the longer the stress occurs, the greater the risk we're going to get down here to dis-ease and either bring back the autoimmune disease, or because we're doing subsequent testing, if we control this dis-ease down here, we're going to have a greater chance that the body's going to respond and recover. And that's what we're looking for, is more sustainable recovery in terms of health. So in this case, we saw a couple of things that were down here in dis-ease. One is cellular electrolyte makeup. So what does that mean? Well, the cell has a certain number of electrolytes. It creates a positive and negative circuit. And that cell, in order to operate, is sort of like the electricity in your house. If that's a little bit off, it's going to cause some change in the frequency or healing frequency of the body. So it doesn't really matter necessarily where that's coming from, but most likely with any type of autoimmune disease, we have the immune system being affected. So that means, since we only had a couple of chronic stressors, is that the body's improving. We're getting back into the roadway and we're staying there more consistently. And so we should see that in the patient as well, where we're seeing more sustainable recovery. The body is healing itself, and we're relying less on medication. That's the most important, is that we want to get down to really using herbs or diet or supplementation versus immunosuppressive agents like the Imuran or prednisone, for example, to control the result of the autoimmune disease. We want the body to do it itself, so it can produce its own anti-inflammatories in the body to control this disease and allow those cells to regenerate and have normal activity again. The second thing in this case was dental, and dental is really important because anything with autoimmune disease it has to do with lymphatics. And so the teeth and jawline is one area of importance. And so if there's dental stress in the history, first of all, we make sure that the oral health is in good shape between brushing or using oral rinses to keep the biofilm and the saliva under control. So we have good healthy saliva when we're chewing the food. We're getting good pre-digestion. So the proper digestion is occurring. And then that leads to better absorption and less absorption of waste that could create more inflammatory agents. So it's interesting, there was a number of other acute stressors in here. There was 31 abnormalities overall. but only 2 of which were chronic. But if we look at the others that more acute stress, it's interesting. With the time we have here, I wouldn't be able to go over all of these, but certainly if you have questions, we can go into some of these other ones in more detail. So I'm glad you requested a video conference, so please enjoy the video. If it formulates questions, certainly we can talk about that. Thanks so much.